We wrote the original guideline back in about 2016, 2017, and things have moved on. First of all, there's been a bit of a name change. There's a move away from eponymous syndromes. So we've lost the apostrophe and the S, we're calling it Sjögren, and we've added disease rather than syndrome. And that's in part because of the feeling amongst the Sjögren community that calling it a syndrome somehow reduces the value of the condition, makes it seem less serious. The second big thing that we did is we've expanded the guideline to include children and adolescents. And although it is predominantly a disease of older females, actually there's an increasing recognition we're seeing more and younger people presenting with the disease. The whole point of this guideline is to help your standard clinician manage a patient with Sjögren. Very often people struggle with making the diagnosis, they struggle with knowing what to look for in these patients, and they struggle with managing them. And often they struggle with the things like, what eye drop to recommend, what order to do things in, how useful is pilocarpine and so forth. We're a little bit more, as rheumatologists, comfortable with the disease-modifying drugs, but actually my experience is all of the little things need to be done well to improve the patient in terms of their day-to-day life, their quality of life and their long-term outcomes. Patients with Sjögren's often complain that they're not taken seriously, that they don't feel that all aspects of their disease are looked at, and I think what this guideline should do is help people manage Sjögren's from the very beginning, from making the diagnosis all through the different phases of the disease, address all the individual bits that patients complain of, the dryness, the tiredness, the skin rashes, etc., and deal with them in a holistic way. Giving people clear management guidelines empowers them to deliver the best possible care.